And we're really going to take you through a couple of different topics on social media and its growth in the cardiovascular community. But I'm going to start by taking it a step back. And so there's been a breadth and a lot of growth of social media in interventional cardiology in particular. Just as you know, when you signed up, a lot of people are telling you to follow the hashtag of this particular meeting, CVI2018. I'm going to tell you about how social media and its growth really allowed engagement in an evidence-based practice of radial first. So why are we even talking about social media? And we've all heard a lot about social media, and that's because of social media's inherent quality of personal engagement, regardless of the platform that you're using. And to date, 7 in 10 Americans are on social media as a way to communicate with each other. And if you look at the data from 2006 to 2018 current, US adults, about 70% are all on some form of social media platform. And when you stratify this by age, US adults at the age of 65 or greater are actually a growing percentage. So this is not just a millennial's home. It's a place where everybody is learning that this is where communication is, this is where there's fast-moving growth of information, and it's being disseminated on social media. And here's just another schematic of the growth of the US population and their engagement in social media from 2008 to 2017. So what about cardiologists, and why is it even taking an hour session at this meeting? Because we see the same growth amongst cardiologists, and to date, and this is unpublished data from MedShare Online, which is a protected community between physicians that's HIPAA protected, where they share cases. And in their database, there are 400,000 cardiologists, 275,000 of which are on Facebook, 262,000 are on Twitter. And a lot of physicians use Facebook for personal reasons, but those physicians who have a page to promote their practice might be using it in a different means. Twitter-based conversations amongst physicians seem to be more professionally focused and less personal, and about 37,000 are using LinkedIn. This is a very complicated diagram, and really what I want you to focus on is we used to see a growth in social media between the recency of your graduation year. Again, millennials or younger, early career cardiologists were on social, but what we're finding, and that matches the older age, not older age, but the 65 and older, as that's catching on, so are the mid-career, advanced career cardiologists, and that gap is narrowing. So why? Why is that gap narrowing? And why are we here, and why are we talking about social media? Because cardiologists are using social media to engage in many different aspects of learning, from case discussions to journal club to advocacy to building their own practice to creating clinical surveys to ask questions that are getting answered at this meeting, to keep up with healthcare news and policy, and to get expert opinion. So this is just a breadth of, and this slide's been used many times before in our talks, but you can use engagement through social media, whether you're engaging with colleagues, you're at a meeting, you want to create a public awareness on a message, or any type of program that you're building, and it's all powered through the hashtag. Because the hashtag gives whatever topic you're speaking about longevity. And it actually links to a very large database in the Twitter sphere. And it can extend to other social media platforms too. Instagram also has a very big hashtag database. But currently, Twitter and Instagram are most hashtag-based social media platforms. And these are just examples of popular hashtags that are used in our community. But the hashtag then allows you, when you use the hashtag, to engage in global scientific meetings, whether you're here or engaging virtually. Similarly, the hashtag, if you just look to the left, allows you to engage in a British Medical Journal club. And same with New England Journal of Medicine. You can just follow an NEJM chat, and you'll be engaging current, real-time in that platform. And you can engage in a bunch of other social awareness campaigns as well. In terms of how hashtags are used to catalog clinical research and case discussions, they're just used to tag a topic. Here, Greg Stone, a major clinical trialist, actually is disseminating information on a new FFR guided strategy for referring patients to CABG. So here you have a clinical a major thought leader disseminating information on Twitter. You have Alraies, he's always presenting high-risk cases, cardiogenic shock cases, tweeting out a question where he's getting feedback about how they would manage this lesion. And here you have Amir Kaki talking about percutaneous axillary access using the hashtag PercAx. This is from some of the work I've done at UCLA, where we used the UCLA Women's Heart hashtag during different events or different research announcements that came out of our cardiovascular center. And here the hashtag is really being used to catalog what we do as a women's cardiovascular center. So I want to talk about radio first, because that was a big movement about a year and a half ago. And really, we looked at the growth of social media amongst cardiologists. We put our heads together and we said, okay, how can we grow the presence of leaders in the field? Because if we're going to engage cardiologists to get on social media, then we need the breadth of information that's on social to be validated. There's no peer review process. But if you have thought leaders on there, what better way than to make sure that the information that's on there is accurate and is well balanced? We noticed that there wasn't a lot of information on social about radial, and we needed a quote-unquote hashtag radial. Chadi and I worked together on a lot of social media awareness when we were fellows, and we finally were able, after 4 or 5 meetings, to grab Sunil Rao and get him to get on Twitter. And then we put our heads together about a month later, and we asked ourselves, how can we leverage the growth of social media amongst cardiologists and improve transradial PCI adoption? And so when you look at transradial intervention growth and this is registry data from Cath PCI, it's really been poor. Between 2007 and 2012, the uptake was really only 6.3% total. And even when you looked at this recent update of 2017 first quarter data, only 36.2% of PCIs performed in the US are through the transradial access. And this is well behind the UK, which has really been shown to increase adoption and improve mortality because it's their default access strategy. So coming back together then, we asked ourselves, and I love this quote by Sunil, to have a big impact, one needs to reach a global audience, and that was the motivation behind using Twitter and creating Radial First. And so Radial First is a hashtag that's being used now to date. I'm going to show you some of the data to really educate best practice, tips and tricks, increase adoption, and reach a global audience. And it was launched January 26, 2017 with this group. And to date, this is how Radial First, and this is very recent data. Radial First is being used to demonstrate how complex cases are being performed using radial access, even with ROTA and a 1.5 burr. You can see people have actively commented on it. It was used in EuroPCR. It's used to catalog new data where transradial intervention is being placed in guidelines in Europe. It's even being used by the peripheral community, and it's being used by IR outside of interventional cardiology. To date, Radial First, and this is data from January 2017 launch to June 2018, it has made 82.7 million impressions. It has about 41,000 independent tweets and 5,200 approximately active users. And so from inception, which is down at the left, all the way to current June 2018, the blue represents the continual growth of new users, and orange is active engagement of previous users. So you can see that the engagement has not only sustained, but has had a steady growth each month. And this is the number of tweets which show the same trend. And again, the impressions have grown and the previous impressions remain the same. And when you take a step back and you look at some Twitter analytics through Simpler have allowed us to show a network analysis of engagement in this hashtag, you can see that there's real thought leaders that are driving this discussion. So here you have engaged thought leaders that are working with other physicians, commenting on how the hashtag is being, all by way of the hashtag, this communication is happening, and this is data from a year and a half. So in summary, in terms of using social media to drive engagement, it's a very powerful tool. It can increase awareness and engage a global audience, and that's evidenced by Radial First. Key opinion leaders and experts can really drive the conversation to create a scalable impact on a global level. And topics stay green and receive continual engagement on social media. one comment that we're always asked in interviews is, how can a fellow get started? One of the best ways, just to focus on key opinion leaders, if you're a fellow and you're motivated to start tweeting, or you're young in your early career, team up with a best practice person. If you know a clinical if you know somebody who's known for a craft or a trade, but they're not tweeting, you can tweet with them. And that's going to give you the ability to leverage and help them out. So people can grow together. You can use your skill set at being good at social and digital and enhance the fact that they've built a very large denominator of high-risk cases. And you can start promoting the practice at your institution that way. We'll have more time for comments and discussion.
Well, thank you, Sheila. I think you broke the ground with this so much information for everybody. The purpose of this session is to engage the audience. We're not here to do a podium. You're sick of sitting here watching wires and balloons and access, bleeding, perfs. So we want to engage you, not because you are learning from the slides, but also want to learn from you. What's your practice and how do you use social media? So by the raise of hands, who is not on social media? Oh, only one person. Okay, that's no platform, nothing. Facebook, Instagram.
Oh, I have Instagram.
Okay, you are in then. So that's the purpose of my question is we're all on social media. And who is using social media just to watch what's happening? Watch your kids, watch your friends, who got married, who went to vacation, who bought a new car, who's going where, right? I mean, that's what we use for. So we're using for professional use, meaning you put up cases and you put discussions and bring up papers and ask people to comment on some scientific documents. Okay, we have handful of people. So the purpose of this session, we try to convince you from transitioning from being everybody on social media to everybody using it professionally, but more importantly, safely. And this is very important, using social media to be safe. And also to assure you that social media is safe if you follow certain steps. All right. So I would like to ask the audience before Yader is going to touch on a very important topic, how to use it for academic profile and building your academic portfolio. Who's afraid of putting putting patient and anonymous patient information on social media? Who's afraid? Okay, so there is fear. Can you tell me why you are afraid? What?
So first of all, like patient confidentiality, which we try our best to minimize. Secondly, cases with complications, we are always afraid like whether we work in a team, if all the team members will be on board in disseminating that particular complication, even as a learning tool. Not everybody is okay all the time.
Yeah, I think, look, most of us work either for a practice or for a hospital, so there's a third party there, and we may not know all the nuances of the legal aspects of this, and there's also interpretations of that, and then the patient approvals of that. So I think historically in peer review press, you can do this, and you have a third party, which is the journal that assures all of this, but in the setting of your own sort of posting, I think there's no protection. And so if you can... I'm not sure what the right answer is, but I've tended to stay away from it for those reasons, and I have other platforms and other ways of promoting myself online without cases.
So you have very high threshold before really you go and post patient information.
Correct. Yeah. I'd probably still go the normal peer review process for cases.
So how do you use it professionally then?
So professionally, I think I use it to build a profile of me as a person in my field. There's different buckets, like new publications, new consensus documents, stimulate discussion, things I do at meetings, like I tweeted now when Sheila was up there with 3 of the slides, things like that, so people can stimulate discussion, but also to build a brand for myself. So I think I use a lot of it for building, who is my name, who is Srihari Naidu, and what am I passionate about, if people think of my name, what do they think about, as an expert perhaps. And that makes my life easier when patients find me or when other referrings try to find me.
So who knows what Dr. Biru is expert for?
Nobody, see? Karjang Shak. Holcomb.
So the reason why I know he's Holcomb person because he posted his team there in the lab. I know he works. He posted a new book that you published, or released, and a new publication as well. So that's why it's very important. Sometimes I see people coming in the hallway. I never met them in my life, but I know exactly what they do, what they are experts in before even introducing myself. And this is through social media. And he's not putting any patient-sensitive data. He's a personal branding. He's branding himself. He's a shock and HOCM person. And therefore, if you are in New York or you have a network or you have a HOCM patient, probably you're going to be the first person come in mind to refer a patient to him. So this is how you can use it professionally. So I saw some other hands who are afraid of social media. Who raised his hand? Just speak up. It's open forum.
I'm afraid of internet trolls and people posting negative things about my post.
That's good. Just to rephrase your answer is, if you put wrong answer, for example, or wrong information, or they would. Okay. So or probably you are not an expert enough, and there's somebody else shows up. He has more experience in the field and comment more. But I would take that as an educational activity. Okay, where somebody corrected me, perfect. And they do that a lot to me. And if they're polite, they direct message me, said, Shadi, you put something really stupid, you have to take it out. And so I go there and take it out. If they are nice and friendly. If they are more, sometimes they put, okay, I agree with you, but however, there's 1, 2, 3, I would consider before doing that. All right? Or say good job and some fist emojis. Which is, you would like to see that, so at least you get feedback from your following a network. Who else is afraid of using social media for professional use?
Well, I just wanted to make a comment about being afraid about comments. I think that social media growth in cardiology has, to some degree, made comments very public, and people try to stay neutral. There are certain responses, but if you don't say anything too polarized, you're probably going to get more of a neutral response. A lot of the negativity that's been expressed, and there were some recent things that happened in May with certain devices and some commentaries directed towards industry and data and usage. And then there's a few other people that have been identified in Europe that have commented on US. But what level of training are you? Okay, so you have other third parties to be worried about, but there's so much. As a nurse who's a program manager, you're in a leadership position. Your voice is so important on social. There are young nurses that would be inspired by your tweets and what you're doing, and if any of the protocols that you're using at your hospital are published, you can disseminate that, and then you're going to be known for your role and your title with your institution. You can always run things by your marketing at your institution to kind of help create a presence, if you want, on social media.
Who's use social media to listen? Meaning just to see what's happening and learn from that. And take that learning opportunity and bring it back to practice. Okay, whoever raised his hand, do you want to comment on that? Anybody? Do you have a mic?
No, I was going to say, I use
It's
it.
working, yeah, it's working.
Yeah, it's working.
Go ahead, Jared.
No, I think, probably many, is this working? Doesn't seem like it. Many of us, you can tweet, as Dr. Naito was mentioning before, articles that you're interested in or things that you want to provide a platform for a certain topic, radial first or so on. But there are a lot of things that I have limited knowledge or that I want to learn more. So when you see other folks that are experts, they're sharing videos or the latest paper or something that you really didn't know about, I would say most of my time in social media, rather than tweeting, I am observing and learning about cases and tricks and how did they dealt with that subclavian tortuosity. Oh, look at that very nice trick. So I learned a lot about that. And what I wanted to add is about this issue of perception or social media. So for example, all these sessions that we've had about cases and complications and tricks, all of this is being recorded. All of this is going to be publicly accessible. It's going to be in YouTube. So it's no different. It's going to be publicly available the same way our posts are in Twitter. So to me, it's a lot about the perception that people have of how it's different in Twitter. I don't know if that makes sense, but equally accessible. Actually, what Twitter makes it makes it more interactive, because then you have people that can actually go back and forth and provide a nice discussion. So just a couple thoughts.
Anybody want to challenge that? Anybody want to challenge Yader? Did he convince you that probably it's, as long as you are practicing safe social media posting, you are okay to do that? Okay. And we're going to show you some safe tips. But you said you learned something on social media and brought it back to practice. Do you remember that example?
Oh, I follow several organizations on Twitter.
And you know what they're publishing or what they're releasing?
Most of it is, I'm a nurse practitioner and I work in cardiac stress testing at UC Davis. So I follow JAMA Cardiology, and I follow some of the stuff from UC Davis. So I'm very novice.
And you are following the local news and also
Local, and then some of the stuff from JAMA.
And I think to your point, to the same point, both social media and not social media, like regular conferences, none of them are perfect. Like everywhere you go, you're going to see postings or presentations that have potentially identifiable data. So I think to keep it as educational and as safe as possible, let's say you're in a community in which you're the only hospital, and you can't post that and the only hospital, and cite your location and say like great case, Impella, cardiogenic shock, STEMI, great success, and post the images, time associated with details, age, because that allows for a lot of potentially identifiable information. So I think if you're going to post educational cases, I think it needs to be like, preferably not time associated and somewhat ambiguous. It doesn't really matter the age and the location. I would just say like middle-aged patient with cardiogenic shock. Here's how we did the alternate access Impella. All the other details, they're really not as important. So that would be a tip of advice, to keep it as educational without putting yourself in the opportunity to, display any HIPAA problems.
That's challenging though, because alternate access is so rare. So it's one thing that came out in a TCT session on social media was that be aware that your patients could be following you. And so your patient's children who accompanied the procedure, if it's done in a small town and some proctor flew in to do percutaneous access and the family knows that alternative access, and then the son is following you on Twitter and you tweet this, it's important to know that they could feel offended or a breach of privacy because they know that that's their family member. It's very important to keep that in mind, even when sometimes physicians engage in discussions with each other and it can get a little heated, but still respectful. Your patients can see that. So it's very important to conduct yourself as you would when you're taking care of a patient, when you're in a professional setting, and to maintain those really respectful mannerisms, because it's public, not just for your own professional community, but for the community at large, including your patients and their family members.
Anybody familiar with media consent? Media consent. Have you came across one in the lab or in the hospital? Anybody raise your hand if you did? Okay. So there is a media consent from your institution. If you contact your media office, whether you work in a health system or a university, contact them and they send you a copy. It's a PDF. So what usually I do, if I know this is going to be a great educational case, as I'm consenting the patient for the procedure, I explain to him or her or the family, look, you are an interesting case. There's a lot of educational tips and tricks generated from this case. We might post this on social media or even use it for presentation and scientific meeting. Are you okay with that? 99.9, they say yes. Nobody will say no. But if this is an extra layer, if that make you more comfortable, just call your media office and get it and consent the patient. Especially because I think what we are doing in the lab, there's a lot what we do in the lab or in echo or on the floor, or you see things on at the bedside. It's not getting broadcasted, and by the time it reaches CVI challenging cases 2018, there is thousands and thousands of cases that have been missed. So use social media to promote that practice or tips and tricks, but have this extra layer of documentation. And this is how I do it in the hospital. I think Yader and they agree with me. And this is can protect you in case something goes really bad, or somebody. So you know what? I consented the patient, and that's my proof.
Yeah, and I think so. And I don't know that there's a. I agree. I don't know that there's a perfect answer from what I've learned. There's a couple of ways. If it's like, let's say, it's a pathologic slide with nothing on it identifiable, that's probably okay. Things like this, that there's no way you can trace like. That's my mitochondria. That's probably okay. But if there's any opportunity that there's something that's potentially identifiable, like most hospitals have actually this media form because most hospitals or healthcare systems actually use these forms all the time when they are doing these news stories about Mr. X. He survived this condition, and we're interviewing him for this channel. They will have them sign that form, and that's that same form that you can use for this sort of aspect, and either do it before or after. In any sort of way of however it works. So yes, that's something that I've learned through you guys as well.
Who in the audience have seen something really bad on social media and they said, I wouldn't have posted this? Okay, so just 2 people. So is it, you don't see anything bad coming on social media? So do you want to tell me what you've seen that you didn't agree with?
Well, lots of things, like political comments. I don't.
Let's keep politics on the side.
I think to what you said too, I've seen nurses post, great case, we had a STEMI, blah, blah, blah. And there's a fine line of keeping it personal.
I think we have a tendency when we get that rush of excitement and success, we just run to our phone and take pictures. And like when you go to vacation or you buy a new car, you get that rush and you take a picture of it and you post it right away. I think the same rush comes when you do a case or something. All right.
I wanted to ask something to Sheila, actually. It is for me, and I think probably for most people, and I'll pass you the mic. When I talk to people that are not on social media, or even people like myself and others that are on social media, it can become a distraction. So like people, you're getting tagged, or there's something, a tweet, or you're busy clinically. How do you advise people and myself, how does one use the tool wisely and maximize the platform, but also and make it something that's synergistic rather than something that's harmful that you're working in? And what do you do in your
I can answer this question better now that I'm actually in practice, and it's very true. If you're just getting started, it's going to take a lot of time. And so they talk about a dopamine release. When you tweet something, you look for a response, you look for engagement, whether it's likes on Facebook or likes on Twitter. In Twitter, you want to get retweeted more than liked, and on Instagram, you obviously want to get liked and viewed. So that is a distraction. If it's going to keep you on, if you're not going to be able to tweet and stop thinking about it, or engage in social and stop thinking about it. Another thing, though, is if you have been active. So I was very active as a fellow. And then I noticed a change when I joined practice. And a lot of that was what Yader is going to touch upon. I work in a couple of small different community hospitals in New Jersey with not a lot of focused, it's not the UCLA health umbrella that I was working under as a fellow. And I didn't have the protection of my attendings. So my tweeting pattern changed. I focused more on awareness and health and prevention. But then I saw a natural dip. And one of my mentors, Dr. Mehran, actually told me, don't worry, you should actually focus on building your practice. So I think it's normal as you go through transitions in your training to watch your social media engagement ebb and flow. It's highly distracting, and to make a high quality tweet, it does take time. You have to know what you're saying. It's got to be accurate. You don't want to it's a professional community now, and thought leaders are on it. And if you're engaging with them at meetings, they're watching what you're doing on Twitter. So your tweets and social media engagement has to be thoughtful, as if you were presenting at a podium. And you should be wise about your hashtag use and your engagement when you tag other people in it. So I think tweets take time. One strategy is to pick a certain time in the day that you're going to tweet. And that can be morning, it can be lunchtime, I'm going to dedicate 15 minutes, or evening. And you can even do it just to view. So when I stopped when I stopped doing a lot of tweets, I started retweeting and I started just following hashtags like hashtag CTO. But I think it's normal and we should always put the patient first.
And I don't know if this is working. I feel like and something that I mean, like both you and Chadi are like true experts in the field and know a lot of details. Something that I actually learned from Jay Whitmer. I don't think he's here, but you know he does a lot of social media work. Is like he was telling me how you can use there are a number of websites that you can actually program tweets if you want to have like an active ongoing presence. And let's say you're busy, but one day you had some time off and you want to have, let's say you wanted to post every certain day of the week, and that way you maintain a presence of whatever it is you do. Let's say radial first. Is that something that you advise, or is that something if you have more something that you want to advocate, or is it better just to free tweet whenever you can?
I can't take that. It's a scheduled tweet. And this is what Sheila comes back into. If you have a mission or you want to promote a practice or you want to brand yourself for something, but you don't have time, like you see a cool thing or there's a new paper came out, you just remember that there is a paper, you take a note of it or something, and then on the weekend or when you have downtime, use a scheduling tool. And these tools it's free website. It's one of them is called TweetDeck, or other one called
Hootsuite.
Hootsuite. They are free software. They are on the mobile as well as the web-based. And what you can do is you can schedule these tweets for the whole week. Every day at 5 p.m. you push one tweet. And it's a paper. I always interesting to read this across JAMA cardiology or this across circ intervention. Anybody has any comments, and you, for example, tag some people who would like their opinion about. Therefore, this way you can keep your follower engaged, and you have a streamline of tweets coming through. If you would like to build up a professional Twitter account or Twitter profile. So this is one of the tools. Other things, you can do a bolus on the weekends. And the bolus, I mean, I have my slides, but I don't think I'm going to go through my slides. But it's on the weekends, especially between 9 and 12 on Sunday. It has the highest reach and the highest readership. I think because people waking up, having coffee, or getting ready for church, like Sunil Rao said. So they have the highest penetration. And also, always use an image. Don't make it just text. As an image. Is it from a paper or is it from a slide you saw in a meeting or something? Use an image or a figure because it always helps engagement. You want to go through your talk?
Yes. So just switching gears.